Hi friends, I am Dr. Pratap Sinato. I have done MD in Forensic Medicine. In today's video, we'll continue with deliriant poisons. In last video, we discussed from datura and cannabis. In this video, continue with deliriants. In that, we'll discuss about poisoning from Erythroxylum coca plant, from which usually the cocaine is obtained. Cocaine, which is obtained from the leaves of Erythroxylum coca, grows all in South America and India and other parts of the world. It is available as colorless, odorless, crystalline substance with bitter taste. This is a plant of Erthroxylum coca with fruits. It is used as a local anesthetic. It is also known as different names like coke, snow, Cadillac, and white lady. It is a drug of addiction and cause lowering of moral tone and loss of decency and self-respect. There are different form preparations are there of cocaine. The common name of substance used by addicts are crack, then pasta, bazooka, and speedball. Crack is prepared by combining cocaine with baking soda and water, which is suitable for smoking. Then for speedball, cocaine and heroin is mixed, which is known as the speedball. Coming to active principle, it contains alkaloid, ecognin, hygrine, and cinnamyl cocaine, which are the different active principles of Erthroxylum coca. The leaf contains about leaf of Erthroxylum coca contains about 0.5 to 1% of cocaine. Come to action, it desensitizes the terminal nerves and causes vasoconstriction at the site of application. It is a powerful stimulant of CNS for a short time, followed by depression. So it first stimulates the CNS, later on it depresses. It is also a vasoconstrictor and also it causes desensitizes the nerves. It is an excitant and stimulator of autonomic nervous system also. It has some sympathetic properties also. The euphoric effects depends on the release of dopamine, serotonin, and other neurotransmitters, especially in the pleasure centers of the brain. So it affects the nerve endings to release some of the dopamine and serotonin, which are neurotransmitters leading to pleasure formation. Coming to absorption excretion, it is rapidly absorbed from mucous membranes and from the subcutaneous tissue. So any part of the body subcutaneous tissue, if it comes in contact, it can be easily absorbed. So it is usual route its intake is by snorting, that is from nasal mucosa. The person usually inhales and leading to snorting, and it can be absorbed from nasal mucosa and by IV route. It is also smoked sometimes. It is rapidly hydrolyzed by liver and plasma esterases to ecognin, methyl ester, and by non-enzymatic hydrolysis to benzyl ecognin. The biologic half-life of cocaine is about half to 1 hour. It appears almost immediately in the urine after metabolized by liver. So after getting metabolized, it can be seen in the urine. Cocaine, amphetamine, nicotine, and barbiturates are some of the compounds which can be found in stomach even when given parenterally. Coming to signs and symptoms, inhaled cocaine, the onset of action is within 1 to 3 minutes. If it is IV is taken or smoked, it acts within seconds and peaks in about 3 to 5 minutes. If it is applied topically to nasal mucosa, the action is about 20 to 30 minutes. If it is ingested, it peaks about 60 to 90 minutes. So only if it is taken IV or smoked, the action is immediately active. If it is inhaled, it is 1 to 3 minutes. Least is 6 to 90 minutes. If it is ingested, the action is takes longer duration. Cocaine produces hypertension, which may lead to cerebral bleeding, rupture of aneurysms, and also can produce coronary artery spasms. So in some susceptible individuals, if the person is already hypertensive or he has aneurysms, it may cause rupture of aneurysms, can also cause cerebral artery spasms in person who have certain diseases. Its action is short, and as such it has to be taken every half hours to maintain high. So since it is easily metabolized within half an hour, so it has to be taken continuously if the person has to maintain the sensation of euphoria. Larger doses may lead to binge, may result in anxiety and panic leading to paranoia. The symptoms has two stages. One is a stage of excitement and stage of depression. In stage of excitement, there is a bitter taste, dryness in the mouth, dysphagia, feeling of well-being, and loss of depression and fatigue. The patient may be excited, restless, and talkative, but this passes into calm, dull condition. So first, the person has, if the person has consumed orally, there is better taste. This afterwards there is excitement, restlessness, and person starts talking. The pulse is rapid, respiration rapid, deep, pupils will be dilated, headache, pallor of the skin, cyanosis, sweating, and temperature is raised. The reflexes are exaggerated, and there may be tremors or convulsions. Occasionally, the patient may have hallucinations and become maniacal. There is often feeling of tingling or numbness in the hands and feet, and numb feeling of the places where the drug has touched, like nose, back of the throat, whenever if the person has sniffed. Next, if the person continues, it goes to stage of depression. In an hour, there is respiration becomes feeble, profuse respiration collapse, convulsions, and death occurs. So there is a stage of depression. All the symptoms are depressed. Death is due to respiratory failure, cardiac failure, or vascular collapse. Sudden death may also occur following IV injection and smoking, then snorting due to cardiac arrhythmias, due to direct action on myocardium and cardiopulmonary arrest. If the woman consumes cocaine in pregnancy, there is fetal death and abortion can be caused. Then the child, if it is continued, the child may be born with premature, often have in developmental behavior, learning problems also can develop. Fetal dose is 1 to 2 grams orally, 20 milligrams IV. Procaine is about half as toxic as cocaine. Butycaine is twice, and duvocaine is 5 to 10 times as potent as cocaine. Fetal period is 3 minutes to 3 hours. Come to complications. Long-term consumption of cocaine lead to several vascular accidents, subocular intracranial hemorrhages, myocardial infarctions, skin necrosis, aortic dissections, and pulmonary infections. Treatment: if it is ingested, gastric lavage is done with warm water and potassium permanganate, charcoal, and tannic acid. If it is applied nose, throat wash should be given. If there is convergence, should be controlled with chloroform or some barbiturates. Amyl nitrate is antidote. So specific antidote is amyl nitrate and is given by inhalation. Airway and circulatory stabilization should be done if there is depression signs are present. Thiamine is given. Naloxone is also given, as sometimes the person may consume cocaine with like other senior depression like heroin or some cannabis. Sometimes may cause, so naloxone can also be used. It may be combined with opium. So for opium purposes, naloxone is given. The symptoms should be treated as generalized. Any symptomatic treatment should be provided. Coming to postmortem appearance, there may be intense asphyxial cyanosis in pulmonary congestion, edema with lungs weighing up to 3 to 4 times normal. Heart may show foci of scarring, which may be source of fetal dysarrhythmias. Pyogenic infections are common with phlebitis, that is inflammation of veins and arteries inflammation. Distant embolic abscess may also occur. Injection sites may ulcerate. There may be regional lymphadenitis, endocarditis of any of the heart valves. Cocaine decomposes rapidly, but blood should be preserved to estimate the presence of cocaine. Cocaine may be detected in the brain where it is least metabolized. So if it is accumulated in the brain, it can be detected. Cocaine can also recur from recent injection sites or by swabs from the nasal mucosa. Coming to cocaine habit or chronic poisoning of cocaine. So chronic poisoning from cocaine is also known as cocaine habit or cocainism, cocainophagia, or cocainomania. Chronic abusers of cocaine can tolerate 10 grams a day of cocaine. It causes digestive disturbances, anorexia, salivation, tachycardia, tachypnea, insomnia. The face becomes pale, eyes sunken, pupils are dilated, gaze becomes shifty, tongues and teeth are black in color. Over a period of time, the addict loses the interest in family, friends, food, sexual activity, etc., and appears emaciated and physically exhausted. Sometimes there is a manic, paranoid, or depressive psychosis develops, which is known as cocaine psychosis or excited delirium. The sniffing habit of the person may lead to ulceration of the nasal septum, but perforation is rare. Degeneration of central nervous system and profound physical deterioration leads to hallucinations, conversions, delirium, delusions of mainly the persecution, that is, person believes someone is trying to kill, and may lead to insanity. There is typical Magnus symptom is present where the cocaine bugs, which is characteristic, in which there is a feeling of as if the grains of sand are lying under the skin or some small insects are creeping on the skin, giving rise to itching sensation, that is form of tactile hallucination. So in tactile hallucination, person feels that under the skin the bugs are crawling or some sands are present, and person continuously scratches the skin, which resulted exhaustion leading to irregular scratches and ulcers. This is typical one as Magnus symptoms or cocaine bugs, which is mainly seen in chronic uses of cocaine. Complication of chronic usage, it may lead to persistent rhinitis, nasal erosions, sinusitis, chronic cough and bronchitis. Coming to circumstance of poisoning from cocaine, it is rarely used for homicide or suicide. It is mainly accidental deaths, occurs from addiction, hypodermic injection, and from urethral vesicle or rectal injection. Overdosage of cocaine may lead to accidental deaths. It is believed to be an aphrodisiac and can be increased duration because of its vasoconstriction action and also by passing sensory nerves of glans penis. Sometimes prostitutes also used inject cocaine in the vagina to cause local constriction. This may lead to accidental death again when if the last dosage is injected, which may lead to accidental death of the woman. These are my references. Thank you.